All right. Well, we are a little bit after 1 o'clock, and per usual, I hear the church bells ringing across the street, so I know that's my cue. Whoops. Um, Thank you everyone for being with us. This month's Virginia Governor's Conference on Aging webinar series will feature Deborah Cohen of Kaiser Permanente. She will be discussing parks, activity, and aging well. And just a quick thank you to our continued webinar sponsor and partner of the Governor's Conference on Aging, Virginia Housing. Big thank you for their continued support. A couple of quick housekeeping items. Um, we really do encourage, and just some logistical items, we do encourage questions. Please submit your questions through the Q&A. That will just help me keep track of all inquiries. I'm going to leave the chat box open. Feel free to drop drop where you're calling from, or if you have any technical questions or questions for me, you're welcome to use that. Or if there's any, opportunity for open-ended engagement there. But otherwise, throughout the webinar, if you have a question, please go ahead and submit that through the Q&A box at the bottom of your screen. And then once we get to that formal Q&A at the end, feel free to use the raise hand feature if you'd prefer to ask your question out loud. I would take you off of mute and you would join us on the screen here. So I just wanted to give you a heads up that that is an option, but the easiest may be just dropping it through the Q&A. So you may have been notified on your screens that this webinar is being recorded. I will share the link to our YouTube page in the chat box in just a few moments. That's where you can find all previously recorded webinars in the series and hopefully this one by the end of the week. And I think that about covers it. Feel free to, again, direct message me if you have any other questions. And I'll mention this again at the end, but slide decks will be provided to all attendees, of course, per usual in a follow-up email to everyone that signed up and registered. Alrighty, well, I think that about covers it. So I'm going to briefly stop sharing my screen just to throw another one back up there. Bear with me. Alrighty. Deborah, are you able to see your slide decks?
Yes, yes, thank you.
Awesome.
I can't hear you now. You're on mute.
Sorry, I hit it too quickly. I just was mentioning I'm handing it over and thank you everyone for
Okay,
being.
okay. Yeah, thanks so much for inviting me to talk, to share about my research. I've been studying parks and physical activity for over 20 years. And yeah, I have a lot of findings that are relevant for people of all ages, but also in particular seniors. So next slide, please. And this is just, I've worked with so many people to do it, and I just want to thank them. You can go to the next slide. Okay, well, as you're all aware, physical activity is critical for health. And it is a huge problem in this country because I think less than half the people actually meet the physical activity guidelines. And it turns out that 12.6% of all healthcare costs are associated with the lack of physical activity. And if people don't get enough physical activity, that's a risk factor for heart disease, type 2 diabetes, osteoporosis, cancer, hypertension, depression, premature death. And, parks, that is the number one place for physical activity, particularly in urban areas. Next. So I started working on understanding, parks and how that promotes physical activity, over 20 years ago. And we developed this method called SOPARK, the System for Observing Play and Recreation in Communities. And what we did is we were able to figure out a way to measure all of the park users by age, gender, race, ethnicity, and their activity level. We also added surveys for people in the parks as well as local residents. And then we documented what was in the parks, the facilities, their condition. Also, we listed the weather, whether there was trash, whether the equipment was broken, and also whether there were homeless people just hanging out in the parks. Next. So, just an example of what we did is so we mapped the parks and we divided them into different sections where we would then go and we start with number one and we'd go to number two, three, all these different places, and we would just observe everybody in that area. And, we would we would document their age, gender, race, ethnicity, whether they were in sedentary, moderate, or vigorous activities. And so you can see some areas are small. There's just, little places, and some are huge, like fields where you can just see from a distance how many people there are and counted them. So, this method of SOPARC has actually been used quite a bit and has been adopted internationally. Next. Okay, originally when we developed the SOPARC, we just were measuring it 4 times a day, 7 days a week. But we weren't sure, is that really reflecting the actual park use? So then we actually did a much larger study to validate it, where we actually measured the park use for 14 hours a day for 2 weeks in 10 parks, 5 cities across the country. And we found that, yeah, it's just good enough to measure like 3 to 4 times a week, 3 to 4 times a day, and you're getting basically similar results. You just do a percentage and multiply, and you get a really good measurement of who's using the park and how much and so on. Next. And then, for a regular park, there's big spaces, but then we also did studies on playgrounds where we have very little areas, so we can see like the swings, and all different uh, facilities in the playground. So there's many more places to be measuring. All right, next. Okay, when our park use, we started in Los Angeles, that's where I live, and we studied over about 100 parks there, and we documented the usage, the facilities, and the conditions, and we surveyed the users and local residents. Next slide. And there's like huge differences between how parks are used. We saw over a tenfold difference. And, there's many factors that are associated with this. And that's really what the studies were focused on, is like, what are the things that attract people and generate more physical activity? So this was really like the way to inspire us doing this more research. Next. So one of the things that people are focused on, especially parks, and of course, all of the architects and so on, they want to add new facilities. They, want more work, and they think that having additional things are going to be important. And so, really, one of our first studies was saying, well, how much does new facilities attract more users in the park? And so there was, this is in LA City, they were going to be adding 5 new facilities. And so we took 5 facilities and we compared with 5 other facilities that weren't going to get revisions. And these were in predominantly Latino and African American neighborhoods that were low income. You can see one park, they developed a new recreation center, another one, a new gym, another one added a picnic area, another one revised the playground, and another one added a new gym. And so we, did all the measurements, several times a day, so many times a week. We measured the use before, and then when they were all done, we measured it after. And next slide is our findings. Actually, there was a decrease in park use, which was very surprising to us. But it turned out that the reason this happened is that we did this in the early 2000s when there was a recession. And because of the recession, they had cut the staffing, they had reduced the programming, they had cut the hours in the gym. And there were so many more administrative things for people to focus on, especially when they lost all these employees. And so basically, things dropped everywhere. And it was because, of the funding for staffing and programming. But there was some positive results when we surveyed people in the park and the people who lived around the park. They said after the, renovations, they felt the parks were safer. But just adding facilities, just that alone doesn't guarantee increased use or increased physical activity. Next slide. We also looked at what was the impact of renovating a senior center and renovating and adding a skate park, remodeling a skate park in a park. And we found that, again, that we didn't see a benefit for remodeling the senior center. Actually, use had decreased from before to after, again, because they had reduced the events and activities. So there wasn't enough attracting people to come to the parks. But the skate park remodeling, that was a big difference. It really increased the use of the skate park. So making it much bigger and more attractive, that did get more people to come to do the skating. All right, next slide. We've also looked at what about fitness zones? If you put fitness zones in parks, is that going to improve physical activity and visitors? And so what we did find is that even though it didn't have a big increase in visitors, the people who were there in the park, they had much more physical activity, so more moderate to vigorous activity than when the fitness zone was not there. We actually looked at the price, like, we even think about, these facilities will last 10, 15 years, and based on the costs, for every 10 and a half cents, they increased a met, is the physical activity quantity that people were engaged in. So yeah, fitness zones are helpful. But again, it's just, not having, just having the facilities alone is not a full way to solve the problem of physical inactivity and being active and going to parks in this country. Next. We also looked at a ciclovia where, the city closed down streets and invited people to be bicycling all over. And this is a thing they do in Los Angeles only a few times a year. But it was very, very effective. So this ciclovia, we put cameras around all of the streets to try and count all of the people who were there. And this one event where we measured it attracted between 36,000 and 54,000 plus, active participants. We actually interviewed people who were there, over 1,000 people, and they said they spent like 3 hours in the ciclovia on average, and it generated lots and lots of physical activity, up to, could be 263,000 met hours. But we also said, well, if we didn't have the ciclovia today, what would you be doing? And 45% said they would not have been physically active. But it was a little expensive because they have to, put barriers on the streets to keep cars from going there, and have a lot of employees and police and so on hanging around. So it did cost a lot, over $1.29 to $1.92 per met hour that was generated. So overall, they spent like 339,000, on the staffing and all the materials and so on. So it's expensive, but it does, attract a lot of people and get them more active. Next. We also evaluated this project called Three Wins, where this is at California State University in Northridge. Dr. Stephen Loy had created an internship program for his kinesiology students. And so they just offered free exercise classes in the parks. And they attracted lots of people, a lot of seniors, especially a lot of women who otherwise don't exercise very much. And that really substantially increased their moderate to physical activity. And we measured, the park use when there was classes, when there weren't classes, and it made a big difference in how many people were there and the amount of physical activity. So actually, the programming really motivates people to get more exercise. Next. We also looked at pocket parks because, in a lot of cities, there's not enough room. There's, so many buildings and not enough space for parks. And so they might have a little space area, less than an acre, where they could, they call it a pocket park. It's just maybe a little small playground for people. And so we compared that to a playground in a regular park, and it was cost effective. It did get more people to be more active. So, people who live nearer to this than to another park, they would walk at least a quarter of a mile to get there. And it did, it was basically cost effective. It was less expensive than a lot of other investments in parks. So these are helpful for people. All right, next. We also looked at dog parks. Not all parks have spots for dogs to run around, but we did this in 3 cities and 6 parks, and we found that almost 12% of park users in those dog park areas, were in the dog park areas. And people said they, walked or watched the dogs there, but it turned out that the people actually stayed shorter time in the park than people there without dogs. And they actually were in lower levels of moderate to vigorous physical activity compared to those who didn't bring their dogs. It's because, you bring your dog to the park, release them, take them off the leash, let them run around, and the people are just sitting around waiting and watching. So they're getting less activity. But this didn't actually account for, did they actually walk to the park or did they drive there? If they're walking to the park and it's, a considerable distance, yeah, they're getting activity. But overall, compared to other park users, they were getting less physical activity. Next. We also looked at mental health because there's a lot of research that's showing that being in nature is really good for mental health. And when we were doing our research, we interviewed people who lived near the park and in the park, and we had them fill out this survey on mental health. And it turned out that the people who lived closest to the parks had the best mental health scores. And, the further away people lived from the parks, the worse their mental health scores were. And so if they had more park visits and more physical activity, they had better mental health. And really, it had a big impact. It was, the same. Living near the park was the same as the benefit you get from decreasing unemployment rates. So that's another important outcome for parks and physical activity. All right, next. We also looked at crime because in a lot of neighborhoods there is, higher crime, and there was at least when we were doing the research, there were some shootings in parks. And so what happened is we looked at the difference in the park use from before versus after the crime and the shooting, and we saw significant reductions, particularly among seniors. That after the shooting, there's a third to 40% fewer seniors going to the parks, 13 to 18% fewer adults, but really we didn't see much change in the use by teens and children. And then, for people who live near where these homicides were, they also reported lower park use. So crime is definitely a negative thing that reduces people, makes them afraid to go out and to be active. Right, next. We also looked at safety, because, some parks are considered less safe, again, depending on the neighborhood. And and especially in the high poverty areas, they're considered less safe. Um, and we were trying to see if that made a difference, but really the only relationships we found with the use were really having to do with the staffing and the programming and whether people said they knew the staff. So the issue about safety, we just didn't actually find any relationship with that as compared to these other factors, the staffing and the programming. And then the other thing we found is that electronic media, if people are spending more time on their phones, on TV, they are less likely to visit the parks. So that's a real barrier now to park use. Next. So what did we learn at this beginning? We said, well, just improving the facilities or increasing the perception of safety, it doesn't guarantee an increase in park use. But what really makes a difference is the programming and the opportunities for social interactions. That increases park use. And so the budgets for staffing, outreach, programming, all of that makes a big difference in how much activity people are getting and how many visit the parks. Next. We also did a study where we pulled data from the American Time Use Survey, and this was, 2014 to 2016, so 10 years ago. And they collected data from 32,048 respondents, 15 years or older. And they, basically said, what were they doing all day? And so we were looking at their free time and to see how much time they're actually exercising. So you can see, and then we, divided it up by people that were below poverty. So, 185% of, income, they're saying is below poverty, above poverty. And we separated by males and females. So the first two, I don't know if you can see where it says men, the first two columns are men, and you can see that the people who are not having poverty, like the wealthier people, they get more. I'm sorry. The poorer people have more free time. The men have the most free time, but they only spend 17 minutes of their free time in physical activity. And you can see the wealthier the group, they have less free time, but they spend more minutes, an average of 26 minutes a day in physical activity. And you can see for women, they have overall less free time and they spend less time in physical activities. So the low income women, they're only spending 9 minutes a day on average in physical activity. And the wealthier women, they're spending an average of 17 minutes a day in physical activity. So, even though you have free time, there's so many other factors that influence your activity. Again, it could be the perceptions of safety in the area, so you don't want to go out, but it's also in these lower income neighborhoods, they offer fewer programming and activities than they do in the higher income areas. Next. So when we look at the actual physical activity, we were looking at where the minutes where they were doing it. And as far as being in parks, only a fraction of the time what they were getting in physical activity was in parks. So most of them say other places, but gym is mainly just the wealthier people are going to gyms. And at home is pretty much similar across, but at parks, it's usually the males, are spending more time in parks than the females. Next. Okay, then we did this study where we were looked at parks all across the country. We went to 25 cities. You can see the maps. And then we measured, we used SoPark and we measured the park use in 2014 and again in 2016. Next. And so we only went to parks where there was a population of 100,000 or more. And only included parks that were between 3 to 20 acres. And they had to be within the city boundaries and managed by the city rec and parks departments. And we didn't use ones that were shared with schools, and we didn't include any specialized sites. So that's how we did the sampling. Next. And so in the first year, we went to 174 parks, 25 cities, and we added a couple more cities. And in 2016, we included 193 parks. And we collected the data during the end of spring and during summer. And we trained the data collectors. They were mainly students or graduate students that we trained to work in the summer. And we, taught them how to do SOPARC, and we checked to make sure they did it accurately. And then we had them go to the parks in their cities and measure the park use. Next slide. So we've found some very interesting findings. So the question is, who is using parks? Who goes there? Next slide. And so it was a little surprising. The biggest users are actually children compared to their population. So, of all the users in the park, 38% that were observed were children, but children are only 20% of the population. So it's almost double, the population. It's not reflecting who lives in the area. Teenagers also almost double. They're 13% of park users versus only 7% of the population. Adults, they're 44% of park users, but they're 55% of the population. And the lowest users are seniors. They're only 4% of park users, but they are 18% of the population. And then if you compare males and females, it's mostly males that are using the park. So for children, of all the children we observed, 40% were female, 60% male. For teenagers, 35% female, 65% male. So that's, surprising that it goes down as the children get older. But for adults, there is almost equal between males and females because a lot of the children, it's their mothers that are taking in and watching them, and not necessarily that the mothers are going on their own or the women are going on their own. And also with seniors, it's actually a little bit more males than females, but not as much of a gap as for the children and teenagers. Um, let's go to the next. Okay, and then we just measured, okay, who is participating in sports in the parks? And it turns out that most of the sports are males that are playing sports. Well, this is, 10 years ago, so maybe it's a little bit different now, but of what we observed at that time, only 8% of the children, of female children, were doing sports, 4% of female teens. And there, we didn't see any adults or seniors doing any sports, in these parks, these 25 cities, 174 parks. And then for males, a third of the children that we observed were doing sports, 37% of the teens, 27% of adults, and 6% of senior males were actually doing sports. All right, next. As far as the most common park facilities, lawns, are almost all the parks, and then play areas is the second. And then these other features, that also, mostly inspire more physical activity like basketball, baseball. Those, vary depending on the park. Also, there's picnic areas, bleachers, all of that varies, sports field. Tennis courts, walking paths were only 29%. 19% actually had seating areas. Okay, next slide. And then the least common were actually gyms and exercise areas, which actually generate the most, among the most physical activity. Dog parks only 5%, skate parks 5%, fitness zones only 2% of parks have them. All right, next. Okay, and so which are the facilities that generated the most moderate to vigorous physical activity, the MVPA? Walking paths was the number one. When they had them, they were very used and a lot of different people using them. I'm going to talk about that a little bit more. Gymnasiums were also very high in generating MVPA pools, skate parks and fitness zones, water features, outdoor basketball, and surprisingly, sports and baseball fields were among the lowest. And when you're looking about per square foot, you know, these baseball and sports fields are big, but because they limit the number of people on the teams, you're just using a lot of space for fewer people. So they're actually the lowest MVPA per square foot. All right, next. So we found that the walking loops, those had way more use. Any parks that had walking loops had more use and especially attracted more seniors. So when you compare parks with the walking loops to parks that don't have them, they had 80% more users and over twice as many more seniors. The MVP levels were 90% higher in parks with walking loops. And, there was even in areas that were not the walking loops, there was more use and more activity. And then parks that did not have the walking loops, they were twice as likely to be empty during the observations. So this is a very important factor in parks, and I know many parks are trying to add them now, but it is really helpful for encouraging people to be active. Next. Okay, so what other factors were associated with park use? So what about acres? Let's see, go to the next slide. So with one more acre, we had 9% more use. Uh, the population, every 10,000 people live within a mile of the park. It was 13% more use. Okay, for reduction in poverty levels. So if you were 10% below poverty, you had 14% more users. Every four more facilities in the park, there were 14% more users. Okay, next. And then for every supervised activity, 48% more users. And then the next one for marketing. So if they had banners, posters, or bulletin boards in the park, 62% more users. And so, yeah, this marketing and supervised activities, events, programs, activities, that is the most important thing that attracts them. And then marketing it. And this is just in the park, but, if you could do more than that, I'm sure they could attract more people to be more active in parks. Next. So we also, we measured in 2014, and then again we went back 2 years later, 2016, and overall there was a 5% decline in park use during this in those 25 cities. But except for one city in Westminster, Colorado, there was a 31% increase in park use. And when we interviewed the park officials there, it turned out that they had started these really interesting creative events. They had something called ballerina dodgeball, where they were playing dodgeball, but they required everyone to wear, the ballet costumes, and then to do, ballet kind of behaviors to when they had a stop, and so it attracted a lot of people. And they also had adult egg hunts. They would hide things for people to go and find. And they also had this story that there was a monster in Stanley Lake, and that it was lying eggs around the park, and even pooping there. And so people would go and search for the eggs and the poop. And that really attracted so many people. It was just, more fun, something to do. And the whole families would go out and, go on these scavenger hunts, basically. So again, events are really important to attract people to go to parks and be more active. Next. Okay, then we also did a study on playgrounds, and we were looking at comparing innovative playgrounds to regular playgrounds, and we looked at the differences in the features, and we found, that makes a big difference. So let's go to the next slide. So before we did this, we had studied playgrounds in London, and surprisingly, the playgrounds there are really huge and creative, and they get so much more use than the playgrounds in the United States. So let's go to the next slide. So when we compared the same size parks in London with the US, they had much higher park visiting hours than we did. They had almost 38% more children. They had more than double the adults. And they had more than double this, moderate to vigorous physical activity compared to what we had. And then when you look at the larger playgrounds, and they're like 8 times, some of them are 8 times larger than the playgrounds we have in the US. They had almost 6 times as many more visitors, 10 times as many adults, 7.5 times more seniors. And they also included amenities that targeted adults. So it's just so much more attractive than the way we do playgrounds in this country. So let's go to the next slide. And so then there was this whole new movement to have these innovative playgrounds. So instead of just having like this, one platform, you just climb up and you can, just slide down or climb down, they have multiple different facilities. And so what we studied, we want to make sure they were built within the last 10 years. They had a unique design or feature. They had different surfacing. They had planted areas, they had open-ended play structures, movable parts, and they also, if they had water play, that was a bonus, also a nearby restroom. And we also looked at different manufacturers, and we also included low-income neighborhoods in this. So let's go to the next slide. So yeah, we went to 10 cities across the US to study the playgrounds, and we measured 30 innovative playgrounds versus 30 comparison ones. Okay, next. And we found that compared the traditional to the innovative playgrounds attracted way more visitors. Um, so it was just the numbers really a difference, not a difference in gender. But we did see a difference in the female adults, so that there were more in the innovative playgrounds, but everything else was similar. Right, next. And then the factors that made a difference, well, if it was a destination location, of course, that attracted more people. So that accounted for a lot of the difference. The population is more people live there. That's also accounted for a difference. And poverty also reduced the use. But overall, it was 43% more people in the innovative playgrounds when you account for these other factors like the size and the location and so on. And next. And so what we found is actually swings were huge, make a huge difference. So 6% more use for every swing that was there in the park. Next. If there's a restroom, 44% more users. Next. Every picnic table, 9% more users. Next. We found looking at dwell time, like how long were people staying and what were they doing while they were there. It turns out that a lot of adults are just on their cell phones and using technology in the parks. And if the people were using the technology, they had a lot less physical activity, and they also yeah, they just spent less time being active. So okay, next slide. And so the person that I worked with, Megan Telerowski, is also a designer of parks. And so based on the findings, she created this new park in Philadelphia where she really, highlighted swings and, the other factors that included. And this park is getting so many visitors and getting so much attention. And actually, Alexandra Lang wrote an article about it and it won a Pulitzer Prize. So definitely gets a lot of attention. And I think, moving to this more creative and innovative design really can be helpful for people. Next. Okay. We also completed a park prescription study where we had doctors and, clinicians prescribe park visits for their patients. And the study we did was for children. asking them to go to parks on a regular basis. We would pick the park, tell them how much to spend, how much time to spend, and how many days to go. And we had the more accelerometers so we can measure their actual physical activity. But unfortunately, that's when we started this, that's when the COVID pandemic began. So people weren't very active. Next. But we did see a big increase so that the people in the intervention group who got the prescriptions, they did increase their physical activity by 14 minutes a week, which, it's small, but it's still significant. And it worked at 3 months and at 6 months. But after that, we didn't see differences with that were measured objectively with the accelerometer. But they did continue to report. They went to parks more often than the people in the control group who didn't get the park prescriptions. And we had bigger increases in the older children compared to the younger children. And also, boys were, of course, more active than girls, but the increase among girls was higher compared to the girls in the control group. All right, next. So, yeah, I mean, just recommending people go to parks can be effective to help people be more active and spend more time in nature. Next. Okay, so, there is some evidence that parks are associated with better health. And so there's some studies that showed some lower mortality, another like people report, better health. But there's also studies that show that, you live near parks, you have better physical and mental health. And so, next slide. So I did a study since I work at Kaiser Permanente. I was able to pull medical records of Kaiser members to see if there's a relationship between park spending and health. And so in 2023, the average spending on parks was 160 per capita, per year, versus at that time, we spent over 14,000 per capita for healthcare. And on average, nationally, people were among the 160 that was spent on parks, 70 per capita was for maintenance, $35 for programming, and 51 for, renovations or capital investments. And then $4 was just for, they monetized for the volunteer hours for people to, help with parks. And so basically it's $3 per person per week for parks, but for programming, you're only talking about 67 cents per person. Next. And so we were looking, we wanted to see how the park spending might be related with health outcomes among local residents. So next slide. And so we pulled data from 10 cities in Southern California. That's, where our health insurance company covers. And we were able to pull over 700,000 records of patients in these 10 cities. And we also accounted for the neighborhood deprivation index because we didn't have any individual data about each person and their, income and so on. Next. So, like I said, we went and pulled electronic health records from over 730,000 adults, and then we controlled for their body mass index, the population density, the neighborhood deprivation index, their age, gender, race, ethnicity. Next. And the average age was 48. It's a little bit more females than males. Mostly Hispanic. That's what's in Southern California. It's the largest ethnic group. And you can see that most people were overweight or obese. And, we also, at Kaiser, they asked people to report on their exercise activity, but a lot were missing. But the average activity per week was only 119 minutes when, the minimum is, really requested is like 150. All right, next. All right, and we also found that more than a third had high cholesterol, 28% had hypertension, 24% had prediabetes. 16% had some cardiovascular disease, almost 16% had diabetes, 4.5% had coronary heart disease, almost 3% had atrial fibrillation, 2.8% heart failure, and 2%, plus had strokes. All right, next. And so, what were the cities spending? And so, most cities were spending closer, around 100, but some less than 100 overall. Irvine was the big exception. They were spending over $700 a year on parks, with most of it for capital investments. But you can see they spent a lot on programming. The orange is the programming. But for most of the cities, programming again is the least how much they spend, and they spend most on maintenance. And I know a lot of them want to spend on capital investments, but I think it's hard for cities these days. All right, next. All right, the findings were really surprising because we found that the more the city spent on programming, the lower multiple disease rates. So for every $30 per capita on programming, there was 13% lower prevalence of stroke, lower heart failure, 8% less atrial fibrillation, 7% less coronary heart disease, 6% less obesity, 4% less hypertension, diabetes, and breast and colon cancer. Whereas the spending on maintenance really only reduced obesity, hypertension, diabetes, and the total spending, had only a small impact at all. So again, this is here. It's proving that programming makes a big difference. Next. We had some negative findings. We didn't see any impact on cholesterol. We thought maybe there was a problem. That we saw more prediabetes, but it turned out that it's probably biased because over 38% of people are pre-diabetic, but not everyone gets it measured, so we don't really have the full group of people who are pre-diabetic. Next. And we didn't control for the individual SES. That's a limitation. We just used the neighborhood deprivation index. We didn't have the distance they were to the parks. We didn't consider the park designs, and it was just cross-sectional and only members of Kaiser Permanente. Next. So it's an association. We can't say it's causal, but if it was causal, the potential, the cost of the diseases was over 4 billion. And if we could spend $30 per capita, we could save $247 million, or only 5.5%. And then the next slide. So if you're spending 30 per capita for 732,000 people, that's $21 million, and you would be saving 11-fold, like every dollar you spent, you'd save $11 in healthcare costs if it's causal. But again, we can't say for sure that it's causal. All right, next. So again, I think park use is really important for health, but it requires more performance measures and more funding. Right now, parks don't have the goals or benchmarks or a way to measure the park use or to prove that it makes a difference. Next slide. So I think, we should have parks be a higher priority and also prioritize the programming, staffing, and marketing. We should track the park use. We need to spend more, and it'd be great if we could do more research on it. Next. And so, my idea is like I'm actually hoping to do another study where we could actually add weekly events at parks, maybe have dances, more scavenger hunts, more creative activities, just do more to attract more people there, have them, do activities and stop spending all this time on, their digital media, because that's going to make a big difference for people's health and well-being, to socialize, to be active. Anyway, that's, my idea, and I hope we can go in that direction. Thank you very much for listening.
Thank you so much, Deborah. That was an incredible presentation. I certainly learned a lot. I've seen a few questions come in, and apologies to the folks online. I noticed that I had the chat. I thought I had enabled it, but it wasn't. So I'm sorry about that delay there for a portion of the webinar. But I think we're on track now. Um, I had a question for you before I hop over to what's in the queue for the Q&A. So, you'd obviously the numbers of seniors that were using parks was significantly lower. Um, how much of that, I don't know if there has been analysis or if you did analysis or if you've heard of any research that dives into whether or not that's maybe because of lack of ability or lack of interest to go, or is it because the parks necessarily don't continue to meet the needs? Because on another side, I had flagged that, okay, there's only, it was a smaller percentage, maybe 15 or around 15% of benches. And, to me, that's at least just, working alongside these folks in the aging sector. I flag that as, oh, well, certainly, to drive seniors to parks, we would I'm just trying to get to, I guess it's a chicken and egg question. How much of it is on the side of the user versus the park facility itself?
Yeah, like I said, I mean, my idea is that it's the events and activities that attract people, and most of the events and activities that are developed in parks are for children. It's the sports and the, games and things, and they have very few, if any, for seniors. And that's, one of the things that I think could make a big difference is, starting to do activities for seniors in parks, having whatever dances, having, you know, just having more socialization. I mean, that would really be helpful for so many people.
And then just a follow up to that, I guess, in terms of marketing and programming, obviously it may be a little bit easier to market to the younger generation that are using the handheld devices where they may see things. Have you seen any success stories or any, instances of successful marketing to the older demographic? I mean, I know that the folks on the call here are probably experts at that sort of thing, but just opening it up.
Yeah, no, I haven't.
Okay.
Yeah.
Um, Alrighty, let me dive into some of the questions that came in. I had seen, so for that London study, I I don't see a full name here, so apologies. A Miss or a Mr. or Way for London. What were the factors explaining higher usage? Just size and more adult amenities? Thanks.
Yeah, I think both of those are really critical. Um, that makes a big difference. They actually had things for adults, and also they have the use of the playgrounds, like the playgrounds here, it's restricted to children. Like you can't have adults, go on the slides and stuff, whereas these innovative playgrounds are actually made for people of all ages. And that's what they are also in London, so that adults and seniors can actually use those facilities, can be on the swings, can do those things. And we don't have that in this country for most parks.
Thank you. Alrighty, another question from Mary Beth Cox. Mary Beth was just looking for, I guess, a little bit more clarification on the types of events or activities that are included in programming when you were, showing the tie between programming and higher attendance.
Well, I mean, a lot of parks have like exercise classes, that could be something, but also events. You have a dance, a band playing. They have, walks, runs, scavenger hunts. Yeah, the more events and activities, it just attracts more people.
Mm-hmm. Alrighty. It looks like if somebody had copied over a question. Alrighty. An anonymous attendee, maybe more of just a comment. And Deborah, you're welcome to expand on it. To me, it's more of a safety issues with more of a safety issue with seniors. And I know that you had a slide earlier on in the presentation about crime, and I'm not sure if there's anything you want to add there. It was more
Yeah,
of
so
commentary.
I mean, there's different aspects of safety. One is whether someone's going to attack you, right? That's you're not safe that way, but also like, is the walkway cement? Are you going to fall over because there's a hole in the ground or it's not even? So I would think, for seniors where they may have trouble walking, you need to have cement, a pathway with cement, not just a dirt pathway. So I mean, those are two separate things, but unfortunately, they're both called safe. So I think both of
And
them make a
as soon
difference.
as you started speaking, I realized that that's probably what the person intended to ask about was maybe rather the build out of
Yeah,
the structures. But um, I think in response to an earlier point, this individual says in Arlington, older adults prefer hard copy program catalogs over online. Um,
right, right. Yeah, so if you can mail, just send a letter where telling people you have an events, or if you just say it's every other Sunday or every week, they know, and then you put a poster or a sign outside, then they can see that too. Because
mhm.
the marketing we measured was only what was listed in the park, not we didn't actually study anything on social media or online.
Okay. Um, I had flagged a question. Well, let me just make sure that there are no other questions in the queue that I may be missing. And folks, we do have a few minutes left, so you're welcome to drop anything. So I suppose a lot of the individuals that are calling in today, a big percentage of them work for the area agencies on aging across Virginia, and I think we probably also have some out of staters as well. Um, just curious and you may or may not have an answer to this, but in the areas in which there may be limited shared green space, what do you know of any, solutions that a program or an agency can sort of utilize to take advantage of being outdoors or doing programming where there is limited park resources?
Well, I mean, I did talk about the ciclovia where, they just had people, riding on the streets. But,
Mhm.
you could do tours and walks through a city. But I think it's the socialization, and the events and the activities that's really what draws people together. Like they want to connect with other people. They don't want to be alone. I mean, being lonely, just being on your phone all the time is just, or TV, it's not really helpful. So for mental health, socializing and being with people, but I mean, there are not very many activities in parks for seniors, and it would be really great if any city could maybe try doing regular activities at parks and see if that helps their seniors.
Mhm.
Because being in nature is also very good for mental health.
This is a very specific question, but just came to my mind because even myself recently on social media, I've seen programs at parks for seniors that are like may involve fall prevention. Um, is there anything that localities or these agencies should be like, bringing up to their planning departments in their respective areas of the state to advocate for like certain structures or certain ground materials that would be more senior friendly?
Well, I mean, I think in general, like as I mentioned, parks are so underfunded
Mhm.
compared to the benefits that they do. I mean, they are basically health infrastructures. And, we spend so much, we wait till people get sick, and that's where we spend all the money. We don't spend money for primary prevention. And so if we would just do more in parks, whether I mean, there's already plenty of places in parks that, are safe and even, like a basketball court. That's pretty, straight and no one's going to fall down unless someone pushes them, on it. But yeah, I don't know that we need to renovate parks as much as we need to actually do programming to attract more people and, have them meet each other and be active.
Hmm. Okay. I appreciate that. And yeah, certainly everybody needs a starting point. So, well, thank you so much. I'm really appreciate your time and you were able to pack so much data into such a short time frame. So, kudos to you and thank you to everyone who hopped on today. Hopefully you can take this information back to your respective communities and um, enjoy the rest of your afternoon. We are right at 2 o'clock, so I don't think we missed any questions. I'll leave any final remarks to Deborah, but again, keep your eyes peeled on your inbox for that follow-up email that will go out to all registrants and attendees.
Okay, thanks so much. I really appreciate your being able to listen to this.
Thank you.
Okay, all right,
Bye,
have a good
everyone.
day. Bye.